Dr. Stanford joins me now. Also with me is Dr. Dorothy Roberts, director of the University of Pennsylvania's program on race, science, and society. She's a professor of law and sociology and Africana studies at the University of Pennsylvania and the author of many books, including Killing the Black Body and another great friend of our show. Thank you to both of you. Dr. Stanford, let me start with you. You made the decision. You and I talked a lot about this, and you made the decision last weekend to get this. And you told me you're a scientist, you're a doctor, you know it's the right decision, and yet it was a highly emotional decision for you, and it is not one you took lightly. It wasn't obvious to you that you were going to get this vaccine. Tell me about that.
That's absolutely right, because first and foremost, I'm a Black woman, and I was long before I became a physician, and I grew up feeling a certain angst about the healthcare system. Much of that was mitigated as I became a physician, but that was still in the back of my mind. And so once I had coronavirus and I had antibodies, scientifically, I planned to follow that with my doctor and check every 4 weeks. I quickly realized that that was not something that most Americans could do, certainly not most African Americans. And people poignantly said, when you tell me it's okay, Dr. Stanford, I will take it. I will roll up my sleeve. And I was concerned that by not, I would be leaning into fears that people might have that I was saying it wasn't safe. And so to alleviate all of that, I received the vaccine on Wednesday.
How are you feeling?
I feel good today. Thank you for asking. My arm was sore, and the follow-up day, I just felt like all the energy had been zapped from my body. I mean, I literally sat in a chair for about 12 hours, the exact same chair. And when I talked to some of my friends in the Black Doctors Consortium, of the 16 of us that received it on Wednesday, the remainder will get some more tomorrow. Half of us had that headache, achy, malaise, sore arm, and the other half said, I felt nothing. So, but I think just emotionally, I felt a sense of relief. I felt a sense of hope, of better days, and I don't want anyone to think that I've forgotten. Even watching you play that footage, it's hard to watch those scenes. But we have to use that information as power to say it will never happen again in my lifetime, and not let us impede it from getting the treatment that we need right now, because it's killing African Americans more than any other group in this country.
Professor Roberts, last weekend, Dr. Stanford and I participated in a Facebook, Instagram chat with a lot of Black people who had questions, real fears and questions about the vaccine. You've done extensive research into bioethics and the deeply racist history of medical research in the United States. You've shed a lot of light on this issue. Do you think these efforts, the efforts of Dr. Stanford and other visible Black medical professionals, both administering the vaccine and getting the vaccine that we've seen so much of in this last week, do you think that's going to cut through the remarkably visceral emotions that surround this issue?
I think it's a big help. I think, as Dr. Stanford said, many Black people are relying on Black physicians to give them confidence that this vaccine works and is safe. But I also think it's important to emphasize that Black people's suspicion of medicine is not only rooted in a past chapter of U.S. history, it's also rooted in experiences that they have today and evidence today that racism continues in medicine. So we can't just, I think, frame this as a problem of convincing Black people to trust medicine and forget about a foregone past. We also have to continually work to make medicine today anti-racist and to weed out the many, many practices in medicine that deny access to Black patients, that treat Black patients differently. Some of these are embedded in medical technologies that either are based on a white standard that leave Black people out or automatically adjust for Black people as if we're a different form of human being. And these are going on right now. Black people have this experience right now, and that also has to be addressed. In other words, we're not just addressing a foregone chapter of U.S. history. We have to address racism in medicine now so that medicine deserves the trust of Black people.
And you divide this interestingly, because the stuff we talk about, Tuskegee in North Carolina and eugenics and sterilization, that's straight up old-fashioned racism. You also talk about the structural inequality that leaves people of color, in your words, especially vulnerable to bad health because of the way in which our society is structured to put them in less healthy conditions. It's less obviously racist, but more obviously socially unequal.
Yes. So let me point out, though, that some of those practices of forced unconsented to sterilization are going on right now in the United States. There was just a revelation about it happening to Black and brown women in an ICE detention center. There was a revelation about it happening in California state prisons. But to the point you're making now, structural racism, the way in which our society is structured in terms of segregated residential neighborhoods, in terms of lack of access to high quality healthcare or food, in terms of police violence and incarceration in Black neighborhoods, all of these are structural factors that explain why Black people are 2 to 3 times more likely to die from COVID in the first place. So all of this is connected. And we have to be concerned not only about Black people being suspicious of the vaccine, but also about whether we might be excluded from getting the vaccine because of different types of priorities of who gets access to health care. So it's not that Black people are afraid of health care. Black people are demanding better health care, right? It's a suspicion rooted in experience and history.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.